Folks, I think we're going to get started here. Good morning and welcome everyone to this morning's webinar, which is Care in the Late Stage. Some of you may know me, some of you may not. My name is Jean Alton, and I'm a senior dementia educator at Alzheimer's San Diego. And I'm very pleased to be co-presenting today's webinar with my colleague, Rebecca McDaniel.
Hey, everybody.
And she is our Director of Clinical Services at Alzheimer's San Diego and has lots of experience working with families and in support groups, particularly around the areas of late stage care for people living with dementia, with end of life challenges and circumstances and topics, and with the death and grieving process as well too. So we consider her one of our resident experts, and she's going to be sharing that with all of us here today. So thanks for being with us today, Rebecca.
Oh, you're welcome. Happy to be here and looking forward to today's class.
I am just going to quickly run through our agenda here today. These are all the different things we're going to be talking about. The changes, both physically and functional wise, that are taking place in the late stage, how we can develop strategies and work on different ways of connecting and communicating with our people living with dementia who are in the late stage. We'll talk about the comfort and personal care that is going on at this time, the transitions that are occurring towards the end of life. And then we will be sharing some care planning resources and some coping strategies. So it's a busy agenda here today, lots of information to cover. So without any further ado, we will get started. And Rebecca is going to take the lead now and talk to us a little bit about physical and functional changes.
Perfect. Thanks so much, Jean. So physical and functional changes, we're going to be talking a little bit in this area about, what you would expect physically to be changing in your loved one or individual, and what areas you will need to be jumping into to assist and aid your loved one in kind of navigating everyday life challenges or issues. So this graphic here, if you've attended some of our other education classes, you may have seen this. We here at Alzheimer's San Diego really frame the progression of the disease as either being early, middle, or late stage. So what is the late stage? Some of you may be attending today because you're curious as to what does that mean. For many of us, it can be very difficult to tell where our loved one is at in the disease because changes can be so incremental over a period of time. And as you know, being a full-time everyday caregiver, it can be difficult to notice minute changes that happen because you're with your person every single day. So we're hoping that as a result of attending this class today, that you will be able to know a little bit more about how we define the late stage and what symptoms you would be seeing in your loved one. So you may be wondering, right, what does late stage entail? How will I know when my person is there? How long will it last? So just briefly want to review kind of what we would frame as early, middle, and then moving into late stage. So early stage, right? We're looking at you're noticing changes that maybe you've chalked up to stress or something else is happening. The person is really performing and navigating everyday life to a pretty significant degree, unattended or unaided. You may be seeing early issues of money management or forgetting something that's very routine or rudimentary that you'd be like, why wouldn't they know that? So some minor changes, but really the individual is very independent in kind of navigating everyday life tasks. As somebody moves into the middle stage of the disease, really you're seeing more instances of sequencing. So the individual may not be able to follow a series of steps, such as, honey, go take out the trash can, right? That's a general kind of broad request, but it does require a certain number of steps to get the trash can out to the street. Really middle stage, that sequencing of how to perform that, what we'd say basic task may become more difficult. You're attending to the person and daily tasks much more frequently. Lots more supervision is required in the middle stage. Lots of safety issues, right? Somebody inadvertently, right, leaving the house or leaving the water running, or maybe, giving money away to somebody on the phone. So the challenges become you're moderating or monitoring the individual kind of all throughout the day for safety issues. Middle stage of the disease, we'd say, is the longest period of the disease. Typically, on average, somebody may live with Alzheimer's disease anywhere from 2 to 20 years. It's quite variable depending on age, type of dementia, also other physiological or physical issues that are going on. Does this individual have COPD, diabetes, right? There's other physical instances or challenges that will impact somebody's progression of the disease. How long they experience dementia, and also just what their symptom set is primarily at each stage. So late stage of the disease, that's really what we're getting into today, right? I want to talk about briefly here just an overview specifically of where in the brain in someone in the late stage is seeing the most changes. Okay, so as you'll see here, this is a great visual of our brain. All of us have these different lobes of the brain, and each one of these lobes is responsible for a different part of our everyday functioning. Somebody who's in the early or middle stage, really the areas of the brain that are most impacted are going to be, it starts in this counterclockwise formation from temporal lobe up to frontal lobe, parietal lobe, occipital. All of these different lobes are being impacted over the early and middle stage of the disease. You may be seeing, right, auditory challenges in deciphering sounds between a radio and asking for a request from the kitchen, right? Being able to really flush out those different sounds or where that sound is coming from can really be impacted in the temporal lobe. So very early on. Frontal lobe, right? You're seeing changes in being able to understand social cues, having instances of difficulty having empathy. So being able to recognize, right, the challenges or the work that you're doing to provide care to the individual, that can be impacted very early on as well. The parietal lobe, you're really seeing instances of sensory changes happening. And occipital, thinking of vision, being able to really decipher between contrasts or different colors or textures, even on the ground from carpet to linoleum. So a lot of changes are taking place over until we're getting to the late stage, or these two areas that are impacted most late in the disease. So we're going to talk about really the cerebellum and the brainstem. So the cerebellum is that portion of your brain that's right above really your neck. Okay, you can feel it kind of, you put your hand back there, that very kind of nestled in the very back. The cerebellum is impacted in the late stage by, you're seeing symptoms of really dexterity, so fine motor skill. So you may be seeing instances where the individual may have some fumbling or some difficulty holding, let's say, a fork or a spoon, holding a pen, being able to button, right, a shirt, or even, kind of fiddle with a zipper on the pants. Maybe even it's a toothbrush, really being able to hold that item and doing those very minute physical activities that require just that dexterity. So you may be seeing that come up, right? Oh, I already brushed my teeth, or not wanting to use the fork or the spoon. So the person may elect to kind of withdraw from those tasks where dexterity or fine motor skill may be required. So looking at that, right, in your loved one, what are they choosing not to use or having difficulty or kind of, throwing up, I don't want that help in that area, right? That may be a sign of the cerebellum being impacted. Also muscle control. So being able to, right, we're all hopefully sitting, maybe we're standing right now, being able to hold oneself or body up in a position. The cerebellum is responsible for that activity. So you may start to see, right, in your loved one, maybe there's some more slouching, or even, right, kind of falling into the couch or the chair and kind of sliding. That may be something to look at. Does this person maybe need some assistance, and, kind of some pillows are being propped? Balance, you may see more kind of inability to have a steady walk or a steady gait, we would call. So being able to walk unassisted. Does this individual kind of use props around the house to guide them or to kind of steady themselves on, whether that's a grab bar or a table or the wall? Are you seeing some changes or some areas in that area? Speech, it may also be impacted in the late stage, or will be impacted in the late stage. So it may be that the individual has less options to find the right words in the conversation that you're having, or something that you're requesting. So you may see words that sound maybe a little bit more garbled or even slurred, or maybe even words that don't quite match exactly what the conversation is entailing. So looking at how speech is impacted, it's usually becoming less broad and a little bit more vague. So you may be seeing a lot more, you're trying to guess or decipher what your loved one is requesting or saying. Working down into the very back of the neck. So the brainstem is the portion of the brain that is connecting the spinal cord to the actual brain. The brainstem is responsible for most automatic functions in everyday life, from swallowing to regulating body temperature, digestion, wake and sleep cycles. So all of the things that we don't think about, right? We're not thinking, okay, take an inhale, take an exhale. Well, maybe if we're meditating. And also just breathing. So you may be seeing some changes in eating, and also maybe being a little bit more cold, wanting to bundle up, and then a reversal of the wake and sleep cycle. So maybe being more awake during the night than during the day, or really sleeping a lot more. So sleeping upwards of 10 to 15 hours a day. Somebody in the late stage may be seeing some changes in that area. So lots of things happening in terms of physical and also just automatic functioning that we don't think about. So some areas to look at. So these changes look like, right, as I said, limited verbal communication, more supervision in terms of physical care or personal care. We'll discuss that a little bit more. Difficulty with chewing and swallowing, mainly because of that change in the cerebellum and the brainstem. And because of the cerebellum being impacted, just changes in physical mobility and activity, because the brain is working harder to do those physical things on an everyday basis. So want to just take a moment to pause. Even just talking about some of those changes, or things that we may be worried about seeing in somebody we love can cause a lot of grief. And we may all name it something different. Maybe sadness, maybe loss, maybe just a heaviness or a feeling like a burden on yourself. Just know that that's normal. And maybe even just right now, taking a deep breath, closing your eyes, taking a moment to just notice that feeling, and that is normal when you're caring for somebody you love 24/7. When somebody is experiencing dementia, this individual, right, is present physically, but also incrementally more and more changing from the person that we've known them to be. And that can be really hard to watch as well. And that happens all along, no matter what stage your person is at, right? So just acknowledging and taking a moment to pause and recognize that is so important.
Right, thank you, Rebecca. So, Rebecca's given us some good ideas of some of the changes that are going on in the late stage of Alzheimer's disease or related dementia. And, some of these changes are losses, levels of functioning and just things that our people living with dementia are not able to do any longer. So as we kind of pivot a little bit and talk about strategies for connecting and communicating, what I want to remind everyone about is how much of the abilities remain in the late stage throughout the course of the disease. And what some of those things are is the sense of one's environment, where they're at. Is it a comfortable bed that they're in or a comfortable couch? Do they have their favorite sweater on? Maybe their favorite blanket over top of their lap? The response to the sounds that are going on around. Is it family members' voices? Is it happy chatter with one another that they are hearing? They're, able to hear and respond some to the vocal tones. So again, is it just quiet and calm, or is it kind of happy chatter, or is it music that's going on that is pleasant, or is it sounds of nature? Is it the birds that are singing outside? Most definitely, when people are around the person in the late stage and they are speaking, the people living in still the late stage can connect to the emotion that they're hearing in the words of those around them. So these are the kind of things that our people living with dementia in the later stages can find connection with, and that we can find connection with them. And often we can also see some responses to some of those nonverbal sensory stimulations that are going on as well. I often have shared in a variety of different classes, but I'll just tell you this one real quick. And actually, you know what? I'm going to hold on to this thought. We've got a couple of other things we're going to do here first, and then I'm going to share my story with you. So I guess I just gave you a little teaser there. So let's just see here. So here we've got a gentleman in the garden. It looks like he's got some pruning shears there. So I'm going to look for some responses in chat here. So get your fingers ready and nimble on your keyboards for chat. And here's my question for all of you is, in just looking at this gentleman, what things would you guess about him? So, I'm going to just start and say, this is kind of random, but he's got a nice watch on his wrist. It's a nice watch. What else? He enjoys gardening. Yeah, he's happy. He certainly looks happy, doesn't he? He has fine motor skill. Looks like he does. Boy, you'd better have when you're dealing with pruning shears. His garden brings him happiness. He's well groomed. Yeah. He may be about to cut off his finger. I hope not. Does not appear advanced. No, if he has dementia. What else might we say? He's got, how about this one? He's connecting with, the environment, with Earth. One of the things I like about this gentleman is his laugh lines around his eyes. That suggests to me that he's been a happy fellow most of his life. So he is standing nice and tall. So the summary here for all of us is to recognize that in these quick snapshots, we do get pictures of people, and that every person, regardless of their physical or cognitive abilities, everyone has unique characteristics. These are the things that make us special, that make us who we are. And our history, the people we have known, people we've loved, the places we've been, the activities we've enjoyed, our values, even the little things like our favorite song, favorite movie, favorite smell. These are all different things that make us unique, that make us who we are. And so, with regards to that, I want you to consider for a minute the unique qualities, characteristics, and preferences and the history of the person that you care for. And if you don't have a pen or a pencil handy, please grab one and jot down some notes for yourself about your person and what those unique qualities are. Now, I saw in the chat a little earlier, one attendee was saying, Mom cannot walk or talk, but I think she can still read. And this attendee writes notes to Mom in big print, big letters. And Mom responds to these little notes. And the attendee is asking, is it possible? Most certainly it is possible. Most certainly. So think about those things. What are the unique qualities, characteristics, and preferences of the person you care for? So think about how we can connect through those unique parts and pieces of your person living with dementia. Do they love pets or the feel of certain fabrics? Would we, if they love pets, do we have a family pet that could come and visit? Or how about even eventually a stuffed animal that feels really soft and is nice to touch and can be cuddled? Would that be something we might bring to our person who's in the late stage? That is a different way of connecting to that history of loving pets. Is there a movie that your person in the late stage loved to watch, and you could put that movie on? Now, are they watching and tracking the movie from start to finish? Maybe, maybe not. But maybe the dialogue, the music, even the visuals that the person may be able to see some of, is a way to connect. And to connect to some rich history as well. It's possible to maybe take a drive to a particular location that they would love to see. Maybe a drive down to the beach. Not necessarily even to get out of the car, but to sit with the windows open, the car turned off, and just smell the ocean and listen to the waves and listen to the birds that are there all along the beach. And just sit and be together with this, enjoying these things. What about favorite smells and tastes? Right away, I think of chocolate chip cookies fresh out of the oven with a glass of milk, cold milk. What are some things that they might respond to? Maybe they can't eat a whole cookie, but maybe they could just have a little nibble of one. Sounds. What are some of the sounds that have meaning for people? I want to give you a bit of a visual in your mind's eye here today that I hope touches on a few of the senses. We were in Utah this past weekend for a wedding, and it was out at a little spot kind of in the mountains. So we were able to see some color change with all the trees, the leaves. It was a little bit chilly. There had been snow at that elevation. There were some small clumps of snow still around. And the leaves were all over the forest floor. And as we walked to the little inn where the wedding was, you hear the crackle and the crunching of the leaves under your feet. And then the smell of fall, that's what it is to me. Just that change in season. It's a bit of the cold in the air and just that smell of the forest in the fall. And there was a little creek that ran by there as well too. So you could hear the creek doing its gurgling. And across the way was a little park for people to, stop and go hiking in and such. And there was a family there, and they had the little fire pit going. They were having a picnic, kind of cold fall day picnic there with the fire going. And so you could smell the campfire as well too. So it was a spot that was rich in terms of the senses, in terms of what you could see, hear, smell, taste. Maybe didn't taste so much, maybe except for maybe imagining the tastes of some of the things coming off of the little fire pit, grilled things. And these are all the different ways that we can be connecting with our folks in the late stage, even when we feel like we're not certain as to how much they're able to take in. So again, think about your person living with dementia and the richness of their history and their preferences, and understand that they can experience connection and a wide range of emotions to these things. They can absolutely enjoy and respond to humor and laughter. And really what we want to be doing is focusing on creating these moments, not memories, but moments, these connecting moments. And so as we communicate with our folks, it's important to use slower and clear speech with shorter and more simplified sentences or phrases. This is not a time where we need to be, nor is it necessary to be over-explaining or long-winded. We can use pictures photos, food, or music to guide our interactions. It's important to be mindful of your physical approach. We want to be slow and gentle, and to be announcing what we're going to do prior to doing it. So if we want to put an arm around a person in a hug, or to be sitting side by side, to let them know we're going to do that prior to doing it. And then watch and listen for those nonverbal or behavioral expressions that people are giving us. So now I'm going to give you my quick little story. So my father-in-law was ill with pancreatic cancer. Actually, I guess it was 5 years ago that he died. And I took a leave of absence from my work to go, this was in Canada, to return home to help my mother-in-law care for him. And he was in the end stages of life. We would get him up into, was a little love seat that was a little recliner love seat. And, you know, normally he and my mother-in-law would sit there together on the little love seat with their legs up. And she needed to go out and do some things. So then I would sit with him on this little love seat, and we would watch hockey or baseball. And he was already at a point where his energy was really on the decline. So we would just get settled there in the chair with the blanket on top of both of us on our legs, and whichever sport would be on. And we would hold hands, my father-in-law and I. And the little signal we had going was, I'd give him 3 squeezes, 1, 2, 3. And that meant, I love you. And he would give me 3 squeezes back. I love you. So we'd just sit there. We wouldn't talk. Just 1, 2, every once in a while, squeeze, 1, 2, 3. Look at each other. Absolutely a lovely moment of connection. And it's something so simple and easy we can all do. I'm getting a little teary.
That's beautiful. I'm so glad you shared that, Jean.
Think about those things, folks. And now we're going to switch gears a little bit, start talking about some of the comfort and personal care changes that are going on in the late stage. You are on, Rebecca.
Thanks, Jean. And really, thanks for walking us through your visual, auditory, experiential, sensory there with the fire and the stream. That was really lovely, and just such a testament to just everyday things that we can be surrounded by, and that when we really tune in and just engage our other senses, there's a lot of richness around us that sometimes we miss because we're doing, or we're trying to just kind of get through the day. So even thinking of your loved one, right? Providing comfort, which we'll talk about here when it comes to physical care, but also, as Jean was mentioning, just the mental and emotional care. But somebody in the late stage, because of those other sensory things that are heightened, right, in the late stage, what a testament it is to really joining your loved one and just being in the moment, slowing down, really listening to that bird, really listening to, or looking at that, those pictures or what have you. So such a great reminder. When somebody, and we're going to talk about here, just when somebody is in the later stage of the disease, it may be that many of the needs that they have, mental, emotional, physical, go unexpressed verbally, because the individual is having more difficulty in finding words to articulate what they need, right? That makes sense based on the stage that they're at. So one of the things that we would guide you or ask you to jot down is, what potentially is your loved one's unmet needs right now, today, this week, where they're at? And this takes some tuning in, just like we were talking about the sensory. So really looking at these unmet needs being in large part a way that they are communicating, right? Because they're not asking for them verbally doesn't mean that they don't have them. So looking and tuning into first and foremost, right, all of our, as humans, most basic needs to be met are we hungry? Do we have thirst? And do we need to eliminate our urine or bowel? Those are at our most basic functions, something that we all need to feel generally some physical comfort. Because somebody may not be articulating whether they're hungry doesn't mean that they aren't. So really in the late stage of the disease, this becomes your job is to prompt, right, the food, to prompt the water. If they say, no, I'm not thirsty, they actually may be thirsty, but may be, right, miscommunicating or misreading that need. So actually, getting a cup of water with a straw and putting that to their lips, they may physically just respond to that sensation on their mouth and then end up maybe drinking quite a bit. And including meals and drink in areas of the house that aren't as traditional. So it may be that the person wants to eat a snack in bed, right? Really adjusting your expectations on where these basic needs, even elimination of urine and bowel, where does this take place in the home, right? Prompting somebody to get to the designated kitchen or the bathroom may be more difficult because of the physical changes that are happening at this stage. We're going to talk about some equipment and medical things that you can incorporate into your everyday environment to help transition some of this. Noticing whether the individual is having pain or discomfort, changing sleep or wake cycles may mean that the individual is a little bit, maybe needs something more stimulating during the daytime hours, or having some more boredom or isolation. And you all know when somebody at a certain stage of the disease says, no, I don't want that. But if you introduce something and in the moment, the person may join and actively participate, but it's the gearing up or the leading up to being asked a broad question. Do you want this? Do you want to go? Would you like this? Taking that with a grain of salt and moving through the activity and seeing in that moment, does the person respond in a way that tells you otherwise from what they're saying verbally or otherwise expressing as a no? So really taking the lead on some of identifying and moving into these maybe potentially unmet needs. So as I said, these behaviors or these signs that you may be seeing, again, nonverbal expression of something really going on. So this may look like you really tuning in and noticing very small changes. Is there a grimacing, a furrowing of the brow when it comes to a certain activity or a certain time of day, or a repetitive movement? Maybe it's a folding or, kind of a Kleenex or something on the leg, or maybe even a picking at the skin. What does that mean? So really just tuning into those ways that your loved one is communicating, but you may not be noticing. So taking a day or even, maybe it's just in the morning time. Okay, so next Monday, I don't have anything on my schedule. In the morning time, I'm really going to slow down and really watch my person. What do they do when they get up? What don't they like? What do they seem to be having difficulty with? Just really breaking up your day and really noticing will really give you some great valuable information on where you may need to intervene a little bit more, and what your person may be needing more of. Any sudden changes that you may be seeing, a real drastic change in mood, behavior, or a really quick, decline in function, physical function, that is not typical of Alzheimer's disease, right? Our changes in our loved ones are slow and steady and progressive and happen over a long period of time. If you're seeing something change from 1 week to the next, that's fairly dramatic and catches you really off guard and doesn't seem to be changing back, really communicating with your doctor. There may be something happening, some sort of infection, such as a urinary tract infection. Please don't discount those, especially when it comes to individuals in the later, middle, or late stage, because personal care with incontinence is occurring. Pain or being able to articulate something that is happening for the person may not be accessible for them. So really looking into, maybe getting some over-the-counter urinary tract infection test strips, just being aware that can be quite common in the late stage of the disease and noticing that change. These needs do require help, especially with the toll that the physical changes are happening. Let's talk a little bit more about what that looks like here. When I'm speaking with somebody, a family member over the phone, and I'm trying to determine, kind of where their loved one is at, this is somewhere where I go to asking is, what is your loved one needing help with when it comes to activities of daily living, or what we call ADLs? Okay. For somebody in the late stage of the disease, you mostly are helping in some form or another in facilitating one or definitely more of these. In the middle stage, you're seeing some assistance with these activities of daily living: eating, bathing, dressing, getting dressed, right? Transferring, so getting from a chair to the bed or out of the couch, help in the restroom, or just walking or moving around, or ambulation. In the middle stage of this disease, you're seeing some changes to these ADLs. In the late stage of the disease, you're really assisting primarily in many of these areas. So you're cueing the person to want to eat, right? You're helping facilitate washing, getting the soap on the body, right? You're helping orient the person's arm to the shirt, them being able to lift, or their brain to send the message of, here's a shirt, I need to lift up my arm. That may be greatly impacted in the late, or will be greatly impacted in the late stage of the disease. So you're facilitating a great deal of these ADLs. Depending, right, because of the disease and it being very progressive and variable, it may not be from one day to the next that you're needing to help in one of these areas. This will be ramping up to a greater degree to where you are fully helping. So somebody who's in the middle stage, you may be noticing, gosh, they said they showered, but I'm really noticing that the hair doesn't look washed, or they're completely dry when they come out of the bathroom. Maybe I'm needing some more help. Helping some in the middle stage is normal. Having to facilitate completely, really, the total act, that's late. That's really indicative of the late stage. So taking stock of these different images and maybe jotting a few notes down. What are you doing in each of these areas? What are you managing? That can help you determine really where your loved one is at. Because physical changes are occurring for your loved one at this stage, initiating small adjustments physically can be very difficult for the person, or they may be unable to do that. So as you're sitting in this chair right now, whether or not you've noticed it, who knows, but you've adjusted. You've moved your legs, you've crossed your ankles, you've moved your arms, you've sat back, you've adjusted to the right, the left, right? Somebody who's in the late stage of the disease, those minor adjustments of just comfort of movement and motion become inaccessible to them because of the changes in the cerebellum and that brainstem. So noticing if your person is really comfortable sitting on the couch and just kind of wants to sit on the couch for hours at a time, Noticing, have they adjusted themselves? Do you need to move in to initiate that adjustment? Adding in a pillow, moving, the arm up. Those things like that will be essential for comfort and their overall kind of just mood and behavioral kind of well-being. Setting realistic expectations, right? Somebody who's in the late stage of the disease, even though they've maybe over a lifetime been an avid walker or love to go out in the garden, they may want to do those things, but may not be able physically to initiate those activities. What can you do to bring that activity to them? Can you cut a rose from the backyard? Can you bring in a basket full of fresh cut grass? Maybe that smell, right? Maybe that's really soothing to them. Maybe it's you picking up one of their legs and moving in kind of a bicycle or a rotation, moving the ankle. All of those, physical things that they may not be able to do can be very comforting to them and really bring them some ease. With more sedentary activity, so right, being more comfortable and for them less initiating movement, comes risk for potentially pressure on the skin at certain parts of where the furniture is, right? The bed, the recliner, the couch, and can cause issues in the late stage of skin breakdown, meaning that because there's not those minute movements, the skin every single day for hours at a time becomes irritated. So even taking a look, right? You may have not thought to look, that part of the calf that my loved one, they're sitting on the couch for every single day. Is there a redness there? Is there a redness on the back of the hips or the buttocks or even the shoulder blades? Looking for those signs are a clear indication of really a need for more support or care. And we're going to talk a little bit more about what can be integrated in. So just looking for those opportunities for movement and motion as connection, right? That's a way to really join your loved one where they're at with the strengths and capabilities that they have in the late stage of the disease. Some supplies that you may not be aware of, but that do exist. You may be thinking, gosh, adaptive supplies, that sounds medical. That sounds outside of my realm. Not sure what to do with those. That's fine. We're not expected to know how to use these items. It takes practice, right? These items, adaptive supplies, are great ensuring that your individual or loved one is safely repositioned. And really, it's a joint benefit to both of you. As you're moving in to provide more physical care, the risk that's associated to you as the caregiver of having injury or tweaks to your own back are significant. And so being willing to purchase some of these adaptive supplies and trying them out can go a long way. So a gait belt is something that it's almost like a canvas strip, almost like it's a belt. And it has two metal rings on the end. And it's meant to assist in kind of moving from a seated or laying down position, and you position it kind of on the lower torso or upper hip area of your loved one. And then you can gently get some more leverage. All of these adaptive supplies, we have a resource list for called medical supply stores. So in the Q&A, in the chat or the Q&A, if you're wanting more information on where to purchase these, we can provide that to you. Resources to help you know how to use these exist right at your fingertips. Your doctor can put in an order for a home healthcare aide to come out to the home and show you how to incorporate these adaptive supplies in your everyday care of your person. It's built into the benefit. So just knowing, hey, doctor, I'm having more difficulty in getting my mom out of bed every morning. Can you put in an order for a home healthcare aide to come out to the home? Short term, but really equips you with knowledge of how to utilize some of these adaptive supplies. So we're going to take a moment here to just pause for some of those questions that you've incorporated into our chat.
So Nellie has been monitoring our Q&A in our chat for us. Nellie, have you got a question for us that's maybe
Yes.
kind of sums up a few things in one?
Yes, I think it would be helpful if you could just give us a quick reminder of what is heightened in the late stages, when and which parts of the brain are being affected, so that we can better understand or try to determine if our person living with dementia is actually in the middle or in the late.
Do you want to take a stab at that, seeing as how you talk to us about the brain, the functioning of the brain, and what's going on in the late stage?
Sure. So asking questions in terms of whether it's middle or late stage, is that the question, Nellie?
Correct. We have some individuals that would like to be better at identifying if their person is actually in the middle stage or are they now in the late stage. And also there was someone that's interested in knowing if they would actually lose or have changes in the senses.
Okay, I do see that here. So I think this is why you're here today, right? Because you're trying to decipher where is my loved one at. And the difficult thing is that, right, everybody who experiences Alzheimer's disease has their own unique, right? There's commonalities among all symptoms and changes, but what your person can do on a day-to-day can be really confusing, right? Because you're like, gosh, this day she did this and this day she did this. But really the difference between middle and late stage is late stage, you are greatly facilitating almost all physical activity. So you're maybe not comfortable leaving the room, right? Because of that ambulation or gait that's happening. Somebody in the middle stage can most likely navigate around the house, may get a little disoriented, but physically can walk comfortably around from room to room, right? If she's having difficulty shuffling or the gait or is, I see here in the question answer, tippy, I would say that's more indicative of a late stage symptom than somebody who's in the middle stage. In terms of losing some of their senses, taste, smell, I'm not sure. That can be impacted maybe even earlier on. So that may be difficulty. Really, the late stage, you're looking at physical changes, how that person is managing just everyday activities.
And I would just add that, think back to the information that Rebecca covered in the first part of the webinar, where, we're really looking at the functional changes that people are experiencing. So we're running just a little bit behind. So we're going to keep going here, folks. And I think you're going to see more information coming along that may help you to have a better sense of where your person living with dementia is at in terms of the stages of the disease. And remember that that's always a conversation you can have with the primary care physician involved in the care of your person to get some, the clinician's perspective on where your person is at. So let me see here. We're going to talk then about these transitions towards the end of life. And with regards to that, here are some of the things. And as Rebecca has already mentioned, the end of life for people living with dementia, well, we'll say it doesn't necessarily look that much different than end of life from other causes, from other diseases. And also that, we're all, just as we live differently, we all die differently. And so what we're giving you here is just general guidelines, observations of the things that can happen at the transition. So keep that in mind. It's not necessarily a checklist that this is going to happen with everyone. But at the transition, what we are starting to see more of is that people are sleeping more and more. More time is spent sleeping than awake. And we do see some increased problems with swallowing. And so we're hearing maybe more choking, and there's some gurgling that can go on in the throat that can sometimes sound alarming, but is actually fairly common. We do see less eating and drinking, and it's not unusual for people to refuse food. So, offering them maybe a little bit of, let's just say some pudding or some warm cereal, oatmeal or something like that, they may be pursing their lips and moving their head away from the offering of the food or from the straw to take in the drink of liquid that, again, just rather than they would open their mouth and either accept the food or the straw, now they're pursing their lips and turning away. We do see altered communications, meaning sometimes there's less communication. Sometimes people get a little bit more chatty though too. And there's just a change in communications. We can see contractures, and this is where we're literally talking about the body contracting. So the hands may be coming in like this, and the arms may be coming in, contracting close to the body. The legs may be bending at the knees and curling up more towards the torso of the body, and just kind of hunching in a little bit more. So these are what we call contractures. And then we have towards the very end of life, really no intake of food or liquids. And people are usually very minimally responsive to our verbal cues or talking to them or to any of those other kind of signals. Cold hands or feet is very common, where we're seeing the blood flow is to the extremities is really much reduced. And that can also then lead to some changes in skin color. We may see some what we would call mottling on the hands or the feet, where we are just seeing some of those changes in color, where the feet and hands are looking more blotchy, mottling. There's changes in breathing, and that can be just the rhythm of breathing being disrupted. So there may be some fast breathing, and then just some silence, like they're not breathing at all, and then they start breathing again. So changes in the rhythm of the breathing. So after a death, first and foremost, of course, is to be following any instructions that have been given with regards to body or brain or other organ donation, and the handling of the remains, whatever that is going to look like, as is indicated through the documentation that has been completed with regards to their after death wishes. And certainly to be contacting obviously key family members and any of those other supports that you are needing, and or just the important people that need to be aware that this death has occurred. Doing the business end of things, which is of course notifying attorneys and banks and insurance providers, Social Security office as well, and any of those other important contacts. And hopefully it's already been done, but that the important documents are all gathered together, and you will likely need to take some of those documents with you for example, to such places as banks, insurance providers, etc., death certificate to provide, again, just the proof of death, the certificate showing that the death did occur. It is also important to know that the person's body does not need to be removed immediately after death. And, you know, you need to just kind of go with, hopefully that's some things you've had some discussion about or given some thought to. If you want to take some time just to be with your person who has just died, that's certainly acceptable. And there's no reason for the body to necessarily be removed right away. And consider some of the rituals that may help you at this time. And I'll tell you another last quick story here with my father-in-law. When he died, my mother-in-law was with him. The rest, myself and a couple of the other family members, we were not there when he died, but we weren't far away. So she called us right away and we got over there to their place right away. And he had, you know, he definitely had passed and it hadn't been very long. And of course, my mother-in-law was, you know, I think you kind of go into some shock, even though, you know, in this case, she knew, we all knew that it was going to happen. So, but one of the things that was important to her in that moment is she wanted him to have his blanket. He had this special blanket he liked, and she wanted him to have the blanket around him. And so we did that. We tucked the blanket all around him, you know, and tucked his feet in because he always had kind of cold feet. And then Mom and I just sat there with Dad, and, you know, she was kind of talking to him very softly and just having some moments with him. And I was on the other side, and we were just there. So, and I think in this particular instance, this was some time that was very important and very valuable to both of us, and particularly to her. So, you know, just know that you can, I think it's important to kind of listen to what your heart is telling you need to do in these moments. So I'm going to hand it back over to Rebecca, who's going to talk a little bit about the care planning resources.
Thank you, Jean. So, care planning resources, this is more of the logistical aspect of support that is available. And just want to say that the next couple slides, we do have some breakout of some other classes. We have a legal financial class that details some of the legal documents that can be helpful. We'll talk about them briefly, but if you are wanting more in-depth information, consider checking out our website with the webinar Legal and Financial Planning. And then additionally, we will be talking a little bit more in depth about this as well. Tomorrow, we have kind of a complement in some ways to this class called Preparing for a Good End, which really details in more depth some of these resources that I'm going to mention here. So please do know that if you're interested in learning more about what we talk about here, tomorrow at 10 o'clock, there will be more information on that. Let's see, doesn't look like, oh, there we go. So in the late stage, inevitably, because of the changes that are happening physically, there are going to be healthcare decisions that you will be presented with. We are hopefully, you're attending this class at a time when you're not in the midst of crisis, but if you are in a position where you're needing feedback and consultation, right now because of where your loved one is at, please consider reaching out to our dementia care consultant staff. I know Nellie will be presenting a follow-up link in the chat So if you're needing assistance or to talk a little bit more in depth, please do utilize that resource. Hopefully, some of these healthcare decisions you can consider now and even potentially think about before you're kind of put in the position of having to decide. So you may be presented with the idea of really thinking, would the person that I love and I'm caring for want these things? Would they want to have CPR provided to them at the stage they're at? Really thinking about some of these areas of feeding tube. There's a couple different types of feeding tubes that would be introduced to you as an option. Typically, somebody who utilizes a feeding tube, in most instances, it's thought of as a short-term solution, right? It's something to bridge a gap. Somebody who's in the late stage of dementia, right? As we're talking about today, they're nearing and they're reaching end of life. That feeding tube is not a short-term solution, right? So thinking about these methods to intervene physically, doing your research, looking a little bit deeper into each of these and the risks that come with introducing these methods at a time when your loved one is nearing end of life. Many of these interventions are designed for individuals who aren't experiencing, let's say, a terminal illness. They may be utilized in other accidents or other instances. So taking with a grain of salt, because these are available, doesn't necessarily mean that they're the best fit or match for somebody who's in the late stage of Alzheimer's disease or dementia. Okay, obviously we're not doctors. If you are wanting more information about how each of these kind of interventions impact somebody in late stage dementia, again, tomorrow we'll talk a little bit more, or even just opening up the conversation with your doctor. You know, if you're wanting the hard facts, what would this look like for my person? What are the risks associated with each of these interventions? And also centering your loved one. Would they want this? What would matter to them at this point if they could tell me, or if they already have, if they've communicated that in documents, considering that. This last point, would they want to be in a hospital? Depending or not, if your loved one is living in a residential care community as they reach late stage or end of life, ensure if they don't have hospice in place, the residential community is required per their protocols, procedures, mandates to transport the individual to the hospital. So something to consider as you're looking at communities, or if your person is already living in a community, does that community have a hospice waiver? That's something there where you can bring in an outside hospice organization to the community, right? So consider that. Some care planning resources. So again, tomorrow there'll be more information in the class about these, but just briefly, there's a lot of aids out there to help jumpstart these conversations, not only potentially with the person that you're caring for, but even for yourself or other family members. Prepareforyourcare.org has some great videos and conversation starters, along with Go Wish cards, kind of prompting questions of posing certain scenarios, and kind of getting at the heart of the matter of what matters most to the individual. Documenting these important decisions takes place through several legal forms or means here in the state of California. An advanced healthcare directive really is the legal document or mechanism that communicates what somebody would want at end of life. Okay, this is, would the individual want to be resuscitated? Would this individual want their organs donated to science, right? Many of those end of life questions are included on an advanced healthcare directive. and names the person who would be consulted in that instance to say, yes, they would want this, no, they wouldn't. An advanced health corrective may be in your file legal box at home, ensuring that your doctor has a copy of that, ensuring that the doctor has reviewed that. If the person is in the emergency room, ensuring that you are starting the conversation. My loved one does not want this. My loved one does want this. Don't expect for the doctor, because they have the document, that they've really read it thoroughly. That is your job as an advocate of your loved one, to communicate and articulate what they want very explicitly and very clearly among staff rotations and doctors. Just something that I'll throw out there from hearing other families who have been in that situation. The POST form, this pink form that you see on your screen, it is a legal document that can communicate also end-of-life wishes. It doesn't cost anything. You can, Google this. We can also send it to you. It doesn't have to be printed on the pink paper. That's just a mechanism for first responders to really be alerted to it. But it is something that you would print off and take to your doctor. Or it has been amended as of recently that even a nurse or a physician's assistant can sign off on this. It also communicates end of life, whether the individual would want CPR. It's a good complement to the Advanced Healthcare Directive, but they don't have to be together. So you can have one or the other. A POST form is something, again, that is voluntary and that can be carried in your purse or put on the fridge. And again, will be talked about a little bit more in depth in tomorrow's class. But if you have more questions, we can talk with you a little bit more about that. Resources that exist in the community and are available that you may not know about or just want to hear more about is palliative and hospice care. Palliative and hospice care, both of which are two separate kind of entities. Both are multidisciplinary, so include you and your loved one kind of at the core or the heart of the matter, but are made up of a variety of different disciplines, all focusing on either mental, emotional, physical kind of well-being. Palliative care is really something that can be utilized here and now, and is addressed at really wanting to intervene on lessening pain and suffering. Again, addressing not only physical, but mental and emotional. So this is something that you can bring up to your doctor and say, I've heard of this palliative care. I'm interested in having kind of a team of individuals checking in on me and my loved one. How are things going? Would it be helpful to coordinate a chaplain to come out? Right? Palliative care is not meant as something at end of life. It's meant as an accompaniment along your journey, along the way of caring for somebody with a terminal illness, which Alzheimer's disease is. So bringing this up to your doctor, the majority of insurances cover this. It can be helpful to just do a quick check-in, but it is something that definitely goes underutilized and can be utilized at any time. It's not time limited. And it's, as I said, underutilized. Hospice care. So hospice care is time limited. Hospice care is meant to be added into your network of support at the end of life. For caring for somebody with dementia or Alzheimer's disease, it can be a little bit more difficult to know, when is my person at end of life? When would they be eligible for hospice? I think the average of utilization of hospice care is about 14 days. Hospice care is designed to be available for 6 months or more. So again, your determination of whether or not this resource is appropriate now is most likely, you may already be eligible. Your person may already be eligible. I always encourage people that if you're not sure, Medicare is covered, hospice is covered by Medicare. It's completely covered, no cost to you. Because of that, asking for a resource list, which we have, of hospice providers, and just calling one and saying, hey, I'm caring for somebody with dementia and Alzheimer's disease. I'm fairly certain, they're having more difficulty in these core physical areas. Could you come out and do an assessment? They can come out to your home and assess your loved one and determine whether or not they're eligible or not. No harm, no foul if they aren't eligible for that support. So leaning on them to be the experts to do that assessment, starting the conversation with your doctor can also be helpful, but don't wait. Hospice care is very valuable, and again, no cost, and can really complement some of the physical care. So coming in and providing a couple showers a week, providing some comfort measures, getting some equipment in the home that you may not know you need. So again, considering to lean on them for that assessment or eval is a great way to kind of approach this resource.
Thanks, Rebecca.
Yeah.
Normally we would stop and have some questions here, but in the interests of time, and so we can be done at 11:30, which is what people are expecting, we're going to just move along, and just know you can continue to put your questions in Q&A, and Nellie will address those, and absolutely we'll do follow-up with you as you request. So let me just see here. So with regards to coping strategies, it's just important to say that with regards to grief, there is no set guideline for it, no universal experience or timeline that makes it, this is how long you should grieve intensely, and this is how long you should grieve moderately, and so on and so forth. It's whatever it is that you are experiencing, that's what it is for you. And let me just also say that, one grief experience does not necessarily mean that come the future, you'll experience grief in the same manner. It can be quite different. And so it is important for you to let go of your expectations of yourself, but also from other people too. This is a good time to practice self-care and protect yourself and allow yourself to fully feel your grief, whatever that looks like. And to identify the supports that are going to be specific to you and helpful to you. And again, it might not be what others think you should have happening in your grief journey. And what others think really doesn't matter. It's what you are experiencing and what you need that is most important. So again, a good time to practice some of those things of self-care that you listen only to those who are being supportive of you in terms of what you need. There's a lot of people you don't need to listen to during the grief process. So notice the things that make you feel good. And, through all this time of caring for a person with dementia and then caring for a person with dementia in the late stages and through the end of life, you've been focused on that person. And that is wonderful. And that's what we do as caregivers and care partners. But don't forget to take time for yourself and to take time for the things that do make you feel good. Our saying that we say often at Alzheimer's San Diego is, you can't pour from an empty cup. And it's never more so true than in the end stages, the late stages. So make sure you're filling up your own cup on a regular basis. So do whatever it is that feeds your soul and fills your soul. These are just some ideas here. You know what is important to you. Make sure you do those things. And I asked you to grab a pen, piece of paper earlier, maybe get that out right now and jot down a few other ideas on what you can do to improve your health right now, the steps that you can take, the things that you can do for yourself that give you joy, that fill your cup. So think about those things. So I'm still stuck on the imagery I gave to you, which I experienced this weekend. And so I'm feeling like maybe this weekend coming, I need to get up to Julian so I can stroll through the leaves on the forest floor and hear the crunching, maybe get some hot apple pie, maybe feel a little bit chilly up in the mountains, just a little bit. That would fill my cup right now. For more information for all of you folks, here are organizations that you can go to, websites specifically that you can go to for more information. And this is all in the email that you'll be getting with the slides that have been in this presentation. And so don't feel like you have to jot these down right now. So they will be in the email you receive. So there's the California Hospice and Palliative Care Association. We'll give you lots of good information about those two types of care and how to go about accessing them. Centers for Medicare and Medicaid Services will tell you about, again, just the coverage that these two programs can provide for people who are in the late stages and end of life. You'll get more information about the Coalition for Compassionate Care of California at this website. The National Hospice and Palliative Care Association. And then for those post forms that Rebecca was talking about, this is where you can download those. And your doctor's office should have those available as well too. There's Alzheimer's San Diego. We do lots of different things. I think most of you folks know that. We have our clinical care staff on the phones answering your calls Monday through Friday, 8:30 to 5. We have our virtual support groups. We have all sorts of online education and training, including the webinar library that Nellie just put the link in chat for you to have a look at. Have our volunteer tech team. Tanvi was here with us today, and we thank her, and Lindsay as well too, assisting. We have social activities and outings for people living with a diagnosis of dementia and their care partners. We do all sorts of supporting and partnering with local research, and you can find more information on that on our website or by calling us. We have a respite program for our people living with dementia and their care partners, where we do match up volunteers to families. And it's kind of a hybrid model at this time, just starting to get to in-person. Still a lot of it is virtual. Vitals is our program that is for people living alone in the community with a diagnosis of dementia, where we're putting volunteers in touch with them on a regular basis by phone and by other technology platforms. So of course, here's the different ways that you can reach out to us to get more information, to get support, to find out about resources. Visit our website, call us, or fill out that follow-up form that Nellie has been putting in the chat. And Let me just see here. Our upcoming programs, we have Preparing for a Good End tomorrow morning at 10 a.m. And this is part 2 of this series, today being part 1 in this series about the late stage of dementia. We have our Spanish language class going on Wednesday, October 27th at 10:30 a.m. And Nellie will be manning that one for us. And we're excited about that. I should say womaning that. She'll be teaching that class. Communication skills on Thursday, October 28th in the afternoon. And that is in partnership with Elder Help. And of course, all the details and pre-registration will be available on our website. That is it for today, folks. We, as always, would like your feedback. So when we wrap things up, you will get a link to an online survey. So please do complete that for us. Again, you'll get a copy of all today's materials, which will be coming to you this afternoon in an email, and a recording of today's program will be available in the webinar library soon. I don't have a timeline for that as yet, but it will be soon. So that's where we're at. Rebecca, thank you so much for being my co-host and co-pilot this morning. And also thanks to Nellie for her support in answering questions and chatting with all of our good people here today. And there was a quick question, are we automatically registered for tomorrow's webinar? No, you'll need to go online to our website to register for that class, okay? That is it. So thank you, everybody.